I wanted to really acknowledge members of the Vari family who are here, Patty and Liz and Brock. Thank you for being with us today. And I know having you here brings additional meaning for many of us in really remembering Rick and his amazing contributions to our medical school and the legacy that he leaves from all of us who remember him. That's the main legacy any of us will have, but also in this case, in this particular lecture. So that's why we establish an endowment fund with lots of support from people in this room and elsewhere to fully fund an endowment that would allow us to invite internationally renowned experts to come give the Rick Vari Memorial Endowed Lecture. And so it's my pleasure now to introduce our second annual Richard Vari Ph.D. Endowed Lecturer, Dr. Ronald Harden. After graduating from medical school in Glasgow, Dr. Harden completed training and practice as an endocrinologist before focusing his career full-time on medical education. He is currently an Emeritus Professor of Medical Education at the University of Dundee and Editor-in-Chief of the internationally renowned journal Medical Teacher. His former roles include General Secretary and Treasurer of AME, the Association for Medical Education in Europe, and Teaching Dean and Director of the Center for Medical Education at the University of Dundee. Dr. Harden's contributions to excellence in medical education have attracted numerous awards, including the Karolinska Institute Prize for Research in Medical Education, which has been equated to the Nobel Prize for Medical Education. He was awarded by the Queen the Order of the British Empire for his services to medical education, and more recently received the Gusi Peace Prize for servicing medical education at a ceremony in Manila, and also an honorary degree of Doctors of Law at Dundee. Earlier this year, he received the Lifetime Achievement Award from the President of the National University of Singapore during the 2023 Asian Pacific Medical Education Conference. So with all of these accolades to him and all of the asks that he receives to come and give talks like this, it's particularly special that he is with us today. He's someone in very high demand, having a career-long set of achievements that anyone would be extremely proud of. During his career, Dr. Harden has developed new approaches to curriculum planning, assessment, teaching, and learning. He pioneered several innovations in medical education that we talk about every day. The OSCE, the Objective Structured Clinical Examination, which has been almost universally adopted as a standard approach to assessment and clinical competency. The concept of the spiral curriculum, in which content is revisited in strategic ways throughout the stages of medical education. The SPICES model for curriculum planning. It's not the Spice Girls model. I think it's the SPICES for curriculum planning and models of outcome-based medical education that are now becoming very, very popular in medical education in the US as well. He has published more than 400 papers in leading journals and is co-editor of many authoritative guides and handbooks with practical skills for medical teachers. As I looked over all of those publications, I was impressed that they were really all geared toward translating theory into practice in extremely helpful ways, not only staying grounded as the best medical educators do in theory, but to really put it to use in a variety of ways, variety of offerings for people who wish to take those concepts and put them into use. In his talk today, Dr. Harden will be sharing concepts from two books. The 8 Roles of the Medical Teacher was published in 2018 and is a resource I'm sure many of you know well by this time. His most recent book, The Changing Role of Medical Students, was published earlier this year. It was co-authored with his daughter, Jenny Harden, a social scientist with extensive experience teaching both medical and social science students. So with great expectations, Dr. Harden, please join me in welcoming Dr. Ron Harden to the podium.
Dean Learman, thank you for your generous comments and for arranging your journey to come back with us this morning. That's difficult. Thank you very much indeed. I've received, as you mentioned, a number of awards and invitations, but really I was especially touched when I received this invitation to address in the memory of Rick. It meant a lot to me to receive this invitation. Thank you. I appreciated the opportunity I had with Rick to talk about medical education and to share sometimes even his challenging views. He shared with me his passion for the subject. Rick was really a great guy, and I'm genuinely delighted to be here with you today to perhaps celebrate that. Over the years, I've had a number of special memories, and one came back to me yesterday, sitting in the garden with Patty at her house, because I remember there a number of years ago when we sat in the garden one delightful evening and had a most marvelous, challenging conversation about a range of things, medical education, but also about gardening, which is my other passion. And also we're accompanied by, for me, the first time, a spectacular demonstration of fireflies in the tree. And I've never seen before then, or even since then, the firefly was there. So that was a very special occasion. Rick played, as we all know, a pivotal role in the school. He was Professor Emeritus of Basic Science Education. But from my personal knowledge of him, he influenced medical education really around the globe. He was a truly international person and received numerous awards. I perhaps knew most of him when he was president of the International Association of Medical Science Educators, where he did an excellent job. One of Rick's interests, always shared with me, was his interest in students and teachers. Indeed, that's why I've chosen that as the theme for my presentation today. We're all in this together. I chose this small, brief video just to introduce this theme, which I think was one of Rick's passions as well, the changing role of students and teachers, the changing role of students and teachers. And that's what I want to explore with you today, why this is such an important theme. We tend to think of the curriculum in terms of the learning outcomes, content, sequence, teaching, learning methods, and assessment. And I heard some very good description of your own curriculum here this morning. But way back some years ago, Joseph Schaub gave this seminal paper on the curriculum, where he said, yes, these are all very well in the curriculum, but key to the curriculum, what he called them commonplaces, key to the curriculum are the teachers and students. That's what is the curriculum. It's not just the learning outcomes, the content, etc. It's the teachers and students. And way back some 63 years ago, in the Scottish Medical Journal, there was a paper on the future of the curriculum. And Sir Derek Dunlop, who was physician to the Queen at that time, said it's important to remember the actual details of the curriculum matter little in comparison to the selection of students and teachers. If these are any good, any system will work pretty well. If they're indifferent, the most perfect curriculum will fail to produce results. Students and teachers are the key elements, and that's what we're talking about today. That's why I chose it as the theme. And I think Rick would have approved this notion of the changing role of teachers and students. Because someone asked me last night in your garden, what did I see as the most important development in medical education? And really, it's what I'm talking about today. It's the most important development in the next decade, I believe, will be this changing role of students and teachers as partners together, working together, as in that earlier video clip. In the International Journal of Students as Partners, it talked about students and teachers working in partnership to enhance learning and teaching, It was a shared responsibility. And we talked about this in the book I just published earlier this year with my daughter. That was a new experience for me as well, the changing role of medical students. And we talked about, in that book, the roles of students as information processors, curriculum collaborators, even students as assessors, students as teachers, peer-assisted learning, or scholar professionals and facilitators of their own learning. And the reason for writing that book, we'd written a couple of years before with Pat Willey, this book, The 8 Roles of the Medical Teacher. And several people said to us, but that's all right, but what about the student? These are the roles for the teacher, but the other key partner in the process is the student, the teacher, and student as partners. We talked in that other book about the roles of the teacher as information provider, facilitator, curriculum developer, assessor, role model, manager, scholar, and professional. These are exciting times in medical education, all sorts of developments. But if they're to succeed, some of these exciting new technologies, new educational strategies, I'm arguing today, it all depends on the teacher and the student. These are the ingredients, the secret ingredients of success in whatever these changes we're planning in the next decade or beyond. It matters, this collaboration. Just a small video clip here.
We need to collaborate. But what does that mean? Collaboration is more than just working together with others. To really work together effectively, especially when resources are tight, we need to invest in good collaboration. Good collaboration means sharing the responsibilities, risks, benefits, and the credit. Good collaboration also means that everyone who is involved works toward a common goal.
Collaboration between students and teachers. What I want to suggest that there are a number of challenges we have facing us in health professions education. A number of challenges, information overload, challenge of future-proofing our students, the challenge of delivering an authentic curriculum, of an authentic assessment to go along with the curriculum, and finally this challenge of scholarship in education. And I want to suggest that if we are to meet these important challenges, the only way we can proceed is by looking at how we can do this in partnership, teachers working with students. So I want to look at each of these and just point out the changing role that teachers and students have if we have to meet these 5 important challenges. First, the challenge of information overload. I think we're all familiar with this. We know that knowledge is doubling. Every 73 days was the last figure I saw in the biomedical sciences. Huge information overload. We know there are more than 60,000 diagnoses in medicine, more than 6,000 interventions. Do we expect our students to know all of these? And these are rapidly changing. That figure's, I think, about 3 years out of date. There's probably many more now. The literature, there's more than 24 million records. And even more alarming, these are expanding at the rate of 2,100 new articles every day. Information overload. How are we going to deal with this problem? Illustrated in this example here, see, we've got this jar and we can't get all the marbles into it. There's been a huge expansion of knowledge, but the time for training isn't increased. When I completed my undergraduate course in Glasgow, it was a 5-year course. It's still a 5-year course, but just look how much more information there is. And I think we have to accept that all the information required by a doctor for his lifelong practice in medicine can't be covered in the curriculum. And there are implications, therefore, of this phenomenon for teachers and students. How do we behave? What do we do differently? Firstly, in terms of the roles of the teacher, one of the traditional roles is as information provider. I was an endocrinologist, and when I was a junior lecturer, I thought my job was to pass all my information about endocrinology onto the students. This is Paul Worley, the dean at Flinders, and he gave a talk at IAMSE. I don't know if Rick was there or not, but in San Diego a few years ago. And he pulled out his iPhone and he said to all the teachers present, look, are you wasting your time giving lectures? Because all your students need to know about your subject is better taught probably on this iPhone. Use your time more productively for other problem solving or other activities. The teacher really should no longer be simply seen as a transmitter of information, but we should be curators of information. There's a huge amount of information out there. We're talking earlier this morning and yesterday at the garden as well about the different resources available to help our students now, particularly relating to COVID. So we should be curators of this information. There was a very interesting paper in the Professional Medical Teacher, John Cookson, talked about this notion of curators. It's an interesting insight. He compared it to curators in art museums and so on. And we are curators for our students of information. And the role of our students are also changing in response to this information overload. they have also responsibility as information processors. And what they have got to find is strategies to improve their information processing. We often don't even think about teaching this, but we know not much more about how information is stored and how it's used, from sensory memory, working memory, long-term memory to output. And how can we help our students to develop these stages and these strategies? They can become better information processors. So that's the first role of thinking of our students. But there's another even or more important role. The students are not just recipients of information, but they should be taught as information seekers, because no longer can we cover all the information they need in medical school. When they qualify for a lifetime practice, they've got to find out and seek the information themselves. And Chuck Friedman in this article talked very much about this. He said, well, 3 things as teachers we should be doing in medical school is helping our students to ask the right question. Secondly, to identify source of information. Where do they go to find the answers? And thirdly, evaluating the answer. And with this topical issue of false truths and so on, it's very important. These are the 3 things we should teach our students as information seekers. This is my granddaughter, Cara, and I said to her, I need to phone your mother. What's her phone number? And do you know it? And she said, yes, I know it. I said, well, what is it then? And she went in her bag and took out her iPhone. I said, I thought you said you knew it. She said, I do know it. Here, it's in my iPhone. Information seeking. So information overload, the first challenge that we've got to think, what's our role as teachers and what's the student's role in processing information? The second challenge I've suggested, perhaps one that's not so well recognized, but I think this should be high up students and schools' agendas now, is future-proofing their students. Future-proofing. What do I mean? Well, this was my grandson, Rory, and ages ago he dressed up like this and said to me, I think he was trying to please me, he said, I'm going to be a doctor, but what do I need to learn to be a doctor? What do I need to learn to be a doctor? Now, it was interesting. I was thinking at that time that he would be going to medical school maybe no earlier than 2028. He'd be finishing undergraduate program in 2033. He would complete his postgraduate training in 2039 if it's all successful, but he'd be practicing medicine till the year 2074. And the question is, what would you have to learn to become a doctor? How to future-proof Rory for practice in 2050 and beyond was really a key question, how to future-proof him. I was sitting at our graduation of our students in Dundee and thinking some of them will be still practicing medicine 30 years later, probably many more. And have we really taught them how they'll practice it for their lifelong learning? So the roles of the teacher, I think we've got to think one of our key roles of our teachers is to prepare our students for lifelong learning. It's not what we teach them in what I taught our students in endocrinology is probably redundant. How will they prepare them for lifelong learning? We talked about this move to self-directed learning. I prefer the word directed self-learning because I think teachers still have a role to help students direct their learning. Help students to direct their learning. So if there's some sort of obstacle in the future for their journey, students have got to cross this obstacle. Using the analogy, as teachers, we can help them lay stepping stones so they can cross this obstacle. So as teachers, we still have a role to help our students in this future direction. And the students too have a role in facilitating their own learning. Facilitating their own learning, thinking of the future. Are they preparing themselves for lifelong learning? Do they realize that? It's not what they need this week to pass next week's exam. Are they preparing for lifelong learning? There's a lot been written about this notion of self-regulated learning, the Amy Guide on the topic, where students take control of their own learning. So students have a different role now. It's not what they're taught in the lectures that matter. but are they taking control of their own learning? In Dundee, for example, this has just taken some of our notes on the student choices. Curriculum design so that students can decide, do they work individually or in pairs? Do they want to use the self-assessment we provide at the beginning or the end of a program? Do they want to read text in some of the online programs, or do they want to listen to an audio commentary? When do they want to study and for how long and in what depth? These are all choices the student has to make in regulating their own learning and in personalizing their learning to their own specific needs. So future-proofing the student, a key challenge for us in the future with implications for the student and how approaches their learning, how as we as teachers approach our teaching. Are we really preparing our students for lifelong learning and the students preparing themselves for lifelong learning? The third challenge I put up is an authentic curriculum. I think we all know the report and the Lancet report and the quotation from Frank et al. Professional education has not kept pace with these challenges, largely because of fragmented, outdated, and static curriculum that produce ill-equipped graduates. He was saying the curriculum is not kept pace and isn't and producing ill-equipped graduates. So the challenge is, are we developing a curriculum that will prepare our students for their work and meeting the needs of the patients they're serving? And it's the notion of an authentic curriculum, I think, is a challenge. Our learners have to develop the ability to perform in the workplace as the doctor. So have we got a curriculum that trains our students to work better in the workplace as a doctor?
When you come down from your ivory tower, you will see how it really must be.
Are we moving down from the ivory tower, or as in this cartoon, have we got the medical school at one side, the ivory tower, and then we're assuming with some sort of leap of faith that these students who go through our ivory tower training will perform well in the real world, will meet the needs of the patients they're about to serve. And what we need is an authentic curriculum that will do just that, that will bridge this gap between our ivory tower and the real world, an authentic curriculum. So our first role as a teacher in curriculum development is to make sure that we've got an authentic curriculum that will do just that. And the role of students as a partner, they can help us work on this authentic curriculum. It was an article in the Times Higher Education talked about a useful pair of hands. It said, the rise of students as curriculum consultants, even students working with us in developing the curriculum. This was an article we published in Medical Teacher, written by two students from Imperial College in London. And during COVID, they seized the opportunity to work over and take charge, and they ran the curriculum for several weeks. Developed new resources, entirely student-driven. But Sharon Kapedia in the article says, however, students as partners, this might raise some eyebrows. After all, aren't teachers there to teach and students there to learn? And she commented that they overcame an obstacle, but when they started this work, people didn't believe it because weren't you there just to learn? We're there to teach. The teacher's there to teach. But she said this was a very conservative view. But by the time they finished, this was completely changed, and teachers have now appreciated their role as partners in the process. Students as curriculum collaborators, students evaluating the curriculum, students as membership of curriculum committees. And as I suggested with the Imperial and Sharon's work, as co-producers of the curriculum. There's in Edinburgh, my daughter was involved with this course in Edinburgh, where she teaches producing a course for educating patients with physical activity. And students actually took charge of this course, the collaboration in developing this course. They developed the course content, developed the learning resources, the learning approaches. Students worked on it as co-collaborators. And this is another case study from Keele University with the self-student partnership to develop authentic PBL courses. These were two students who had experience of sickle cell disease, and they developed from their lived experience a program for students, developed by the students. So many examples that this isn't just science fiction. This is a reality. Students can actually help and develop the curriculum. But not only authentic curriculum helped with by the students, but authentic assessment.
But here in the real world, it's not that easy at all. 'Cause when hearts get broken, it's real tears that fall.
In the real world is not that easy at all. And assessment is not easy in the real world either. In fact, it's probably the area where there's most disagreement between even experts in the subject. But teachers and students have a changing role in assessment. It's important for the teachers to look at authentic assessment. Don Melnick, chairman of the National Board, wrote some time ago, it's the curriculum that instructs teachers what to teach, but it's the exam that instructs students what to learn. So what we set in the exams, if it's not authentic, if it's nothing to do with practice of medicine, students won't bother learning it. So it matters what we do to deliver as teachers an authentic assessment. And for students too, they have a changing role in assessment. As assessors of competence, I think they can help us check the authenticity of assessment. They should be on the committees that are responsible for the curriculum and for assessment. And they can, is this assessment we're having, does it match what are the learning outcomes or competencies expected? But beyond that, I think they have an important role in self-assessment, a role in self-assessment. This is a family out for a picnic on the river, but they really haven't assessed their own situation very well. And I think we need to think about self-assessment. And I really like this quote from If Mind Matters. We must constantly remind ourselves that the ultimate purpose of evaluation is to have students become self-evaluating. If students graduate from our schools still dependent on others to tell them when they're adequate, good, or excellent, then we've missed the whole point of what education is about. So the challenge of education is to help our students to evaluate themselves. Again, back to thinking a few slides back, these students, or Rory, may be still practicing 2060 or whatever, and beyond that. Are they competent? They've got to assess themselves. So checking authenticity of assessment, self-assessment. But there's a third changing role for student we need to think about. And this is challenging to us as teachers, is the role of students as peer assessment. We talk about how do we assess students' attitudes? It's important, one of the competencies, but how do we do that? And I'm suggesting peer assessment. Students can play an important role in this. It's difficult, but it's an important role. Just give an example of the problem. This is Harold Shipman. I don't know whether you know the tragic story of Harold Shipman. He was a general practitioner, family physician in the UK. And this, I think, can't happen now. But a number of years ago, he was responsible for the death of more than 300 of his patients. I mean, just think of responsible for the death of more than, how can that happen? He graduated from medical school, went into general practice. And I happen to know someone who was in the same year of him at school. And she said to me, look, we weren't surprised to read about this at all. He was terrible with patients. We never dream, for example, of having, if he was a doctor, treating ourselves or our families. He had completely the wrong attitudes to medical practice. And yet he got 10 in the top 10% of the class for in the exams and graduated. But he completely wrong. But who knew about this? Maybe some of the staff had ideas, but it's the students who really understood this. And if we'd asked the students, if the school had asked the students about his attitude and built in some student dimension for attitudes, it would have been found out that he was inappropriate and should not have been qualified. So students have a role in assessment, authentic assessment. And finally, scholarship in education. We're hearing much more about the need for evidence-based practice in education and scholarship in education. And as teachers, I think there's a changing role as scholars, changing role where we have to much more reflect on what we're doing as teaching, reflect on it. We've got to review the evidence. There's evidence out there, the best evidence medical collaboration. I think we've now published over 100 guides with evidence on different aspects of education. And we've got to undertake research, and I know some of that's happening here, research in medical education, and innovate, bring about changes in education. These are all responsibilities for the next decade, and they've got to communicate about what we're doing at meetings on medical education. So the teacher as a scholar, but also one of the key roles of the student. The student is also a scholar, and school's got to work with us as a partner in reflecting on the teaching. It's a partnership and in reviewing the evidence and researching, innovating and communicating. And I'm almost impressed at the AME meetings, some of the presentations, some of the best presentations on research and education is given by students. And in our journal, Medical Teacher, way back in 2000, there were very few students as co-authors, only about 2%. But by 2010, it had risen to about 10% of papers. But look, by 2017, it was over 15% of the papers were co-authored by students. I really need to update this to last year, and I expect it's even higher. So students are really showing genuine collaborating, co-authoring papers, working with staff, with teachers in research and medical education, reflecting on it and communicating it in the journal. So a true partnership of teachers and students. So I've highlighted what I saw as 5 challenges facing us in the next period: information overload, future-proofing our students, the need for an authentic curriculum and authentic assessment, and the importance of scholarship in education. And I think for all of these, if we have to face these challenges, we must think about the implications for students and teachers and recognize there's a changing role. Things aren't as they were 5 or 10 years ago. There's a changing. What do we mean by being a good teacher? What do we mean by being a student? The role is changing, and I've tried to summarize some of these in this session on the changing role of teachers and students.
Why do I stand up here? Anybody?
To feel taller.
No. Thank you for playing, Mr. Dalton. I stand upon my desk to remind myself that we must constantly look at things in a different way. See, the world looks very different from up here. You don't believe me? Come see for yourselves. Come on. Come on. Just when you think you know something, you have to look at it in another way. Even though it may seem silly or wrong, you must try. Now, when you read, don't just consider what the author thinks. Consider what you think.
You have to look at something in a different way. And that's, I suppose, what I'm suggesting that we need to do, is to look at things in a different way in terms of what's the role of teachers and students, not the traditional role when I qualified all these years ago. And when in the report from Australia a number of years ago said things won't change because of the conservatism of the medical teachers and medical profession. Things have to change, but we've got to look at it in a different way. And in education leadership, it talk about giving students more ownership of the learning, students as partners in the learning process. Indeed, we've talking in the last few years about threshold concepts in medicine. Well, what are the things students really need to know before they move on to the next phase in the medical curriculum? Well, maybe rather provocatively, I want to challenge us by suggesting that there are some threshold concepts in medical education as teachers. If we have to go on thinking about how we're working in curriculum committees and developing ourselves as teachers, there's a threshold concept. And what I'm going to suggest is a threshold concept that we've all got to master is this acceptance of this changing role that we have as teachers and the changing role students have as working with us as partners This is an important threshold concept. The student as a partner. And in our book, we talk about this participation ladder, where in the bottom step, there's no participation by students, no partnership with them in the curriculum. And at the top, students are complete control, as they were for a short time at Imperial. Probably both ends of the ladder are not attainable. But the question, where do we want to be as a school? Where does the school want to be on this ladder of student participation? We suggest there are 8 different steps. How actively we want to work with students in the curriculum. As we move up the ladder, there's more involvement of students. As we move up the ladder, there's shared decision making. As we move up the ladder, there's more equality. And we destroy away from this hierarchy that is very strong, embedded in us, conservatively in medical schools. So where do we want to be on this ladder? The last slide, I want to end just with this. It's the book by Thomas Friedman, who probably you know from other books, The World is Flat and so on. He said in this book, he was once waiting for a visitor, and the visitor arrived 20 minutes late, who was very apologetic. And he said, don't apologize for being late, thank you. Because what it's done is given me time to think. I don't normally have time. I'm so busy with my day-to-day work that I don't have time to think. And what waiting for you has given me time to think. And what I think situations like this, opportunities to attend meetings and to talk about these challenges facing us in medical education are time for us to think. So thank you again for inviting me, Dean and colleagues. I'm delighted to be with you, and I'd be pleased, I think we have a few minutes to have your comments on perhaps at times provocative views, but challenging views on medical education. Thank you.